Alright, class, today we're going to be talking about CRPS, or Complex Regional Pain Syndrome. What is CRPS? CRPS is a form of chronic pain that usually affects an arm or a leg. CRPS typically develops after an injury, a surgery, a stroke, or a heart attack. Pain is out of proportion to the severity of the initial injury. So what that means is you could get uh, a fracture in a bone in your foot, and then the pain from the CRPS would be extreme compared to that fracture pain. CRPS is uncommon and its cause isn't clearly understood. Treatment is most effective when started early. In such cases, improvement and even remission are possible. Symptoms may change over time and vary from person to person. Pain, swelling, redness, noticeable changes in temperature, and hypersensitivity to cold and touch usually occur first. The affected limb can become cold and pale. It may undergo skin and nail changes as well as muscle spasms and tightening. Once these changes occur, the condition is often irreversible. The cause of CRPS isn't completely understood. It's thought to be caused by an injury or difference to peripheral and central nervous systems. CRPS is typically occurs as a result of trauma or an injury. CRPS occurs in two types with similar signs and symptoms but different causes. Type 1, also known as reflex sympathetic dystrophy (RSD). This type occurs after an illness or injury that didn't directly damage the nerves in the affected limb. About 90% of people with CRPS have type 1. There's also type 2, which is often referred to as causalgia. This type has symptoms similar to those of type 1, but type 2 CRPS occurs after a distinctive nerve injury. Some of the symptoms of CRPS is continuous burning or throbbing pain, usually in the arm, leg, hand, or foot, sensitivity to cold or touch, swelling of the painful area, changes in skin temperature, alternating between sweaty and cold, changes in skin color ranging from white and blotchy to red or blue, changes in skin texture which may become tender, thin, or shiny in the affected area, changes in hair and nail growth, joint stiffness, swelling and damage, muscle spasms, tremors, and weakness, decreased ability to move the affected body part. So it affects a lot of your body in pretty nasty ways. Some of the complications. If CRPS isn't diagnosed and treated early, the disease may progress to more disabling signs and symptoms like tissue wasting, which is atrophy, and muscle tightening. Your skin and bones and muscles may begin to deteriorate over time, or they'll even contract into a fixed position. Prevention. These steps might help you reduce the risk of developing CRPS. One of these would be taking vitamin C after a fracture. Studies have shown that people who take a high dose of vitamin C after a fracture may have a lower risk of CRPS compared to those who didn't take the vitamin C. Another thing you could do is early mobilization after a stroke. Some research suggests that people who get out of bed and walk around soon after a stroke reduce the risk of developing CRPS. If you do get it, some treatment is medications and therapies. Some of the medications you can take are pain relievers. Pain relievers available without a prescription, such as aspirin, ibuprofen, and naproxen sodium, may ease mild pain and inflammation, but you might need prescribed medications also. Also, antidepressants and steroids and bone loss medications, sympathetic nerve blocking medication, intravenous ketamine, medicines to lower blood pressure, and therapies, like I said, heat therapy, topical treatments, physical or occupational therapy, mirror therapy. These all increase blood flow and relieve pain. There's also electric nerve stimulation, biofeedback, spinal cord stimulation, intrathecal drug pumps, and acupuncture. Those are all different types of therapy that will help. The reason I'm so passionate about this affliction is because my mother-in-law actually has this, and one of the things that we like to do is donate to a nonprofit organization that helps people with this affliction, and that would be the RSDSA, the Reflex Sympathetic Dystrophy Syndrome Association. The RSDSA is a 501(c)(3) not-for-profit organization based in Milford, Connecticut. It was founded in 1984. Their mission is to provide support, education, and hope to everyone affected by the pain and disability of CRPS and RSD while driving research to develop better treatments and a cure. They provide money to individuals with CRPS who need emergency funding to pay for heat and other utilities, rent, durable medical equipment, travel expenses to obtain medical care, and more. They sponsored the third annual 4-day virtual conference attended by thousands of people with CRPS, caregivers, and medical professionals. They continued a publication of monthly digital newsletters in rare form of the CRPS community, which is sent to 21,400 emails with an open rate of 32%. So it's about 8,000 emails opened it. Sponsored 9 Facebook Live presentations, which highlighted CRPS research, treatment, and many interventions to manage CRPS. Viewed more than 33,000 times. They launched their third virtual walk, which raised 111% over the cash goal. They had more than 250 participants and 30 teams. The live stream on walk day visited walkers from California all the way to the New York Islands. They answered more than 5,000 emails and phone calls, which poured into their office. Compassionate staff answered questions, provided information packets, and a list of knowledgeable health professionals who understand and treat CRPS. They also host invitation-only research meeting in Toronto, along with the International Research Consortium, to discuss the direction of CRPS research and our next steps for a study of targeted treatment based on subtypes of CRPS, along with the Pediatric Coalition Against Pediatric Pain. TCAPP hosted 2 sessions of the Zoom log camp for ages 7 through 18. This includes 6 planned activities such as Lego Masters, art therapy, escape rooms, Disney bingo, and baking with a chef. All gatherings were virtual. They help sponsor successful community building awareness and fundraising in-person walks in California, New Jersey, and Texas, as well as our annual virtual walk. So they do a lot for the community, and this is not a big community. It helps just spreading the word and making other people aware of this condition.